Welcome all to the Afro-Asia Menstrual Health Management Summit. We are so excited to have all the panelists, all the listeners. Menstrual health is something that we cannot wish away. It is something that does not understand that we are during this time of pandemic. It's still there. It's very faithful. Every month, all women have to receive. Unfortunately, some of us still do not understand how the menstrual health and hygiene works, and some of us cannot afford the basic standard hygiene product. And today, I'm so excited that Toto Africa and AL50 is here and is hosting this event that we can share thoughts. We've invited panelists, experts who are going to discuss way forward and how ladies and how even men can support women in this menstrual health and management topic. So with that, I welcome everybody officially in our 2-day summit. Welcome, ask questions. The panelists are here, and it's going to be a thought-provoking discussion, and I'm really looking forward for this. And this is the first one. I know next year is much bigger and more engaging and more beautiful. Welcome everybody again. Nyamat, kindly pick it up and show us the first video. Welcome.
Hello everyone, my name is Sami Mtua, a beneficiary at Toto Africa. On behalf of Toto Africa team and partners, I would like to welcome you all to our virtual Afro-Asia Summit 2021, Menstrual Health and Management. Please join us as we tackle various themes like menopause, nutrition, sports, myths and taboos, culture, disability. All embrace, empower, and support our moms, sisters, grandmas, and men. Oh yes, and men. Please don't be left out. Thank you.
Thank you. That was quite engaging. That is one of the boys at Toto Africa. It's quite engaging. Thank you so much, Sami Mutua. We'll go back now to the panelists. Jimmy, the moderator, kindly pick it up and let's dive in. Welcome.
Thank you. Thank you so much, Tina, for that wonderful introduction. And hi, everyone. Hope you guys are okay. You have your glass of water next to you, because this one is going to be lit. It is well planned, and we're going to have a very, 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 very good discussion amongst ourselves. So, by myself, my name is James Owera. I'm a community development practitioner, and I'm also a child rights activist. I also work for the organization called Initiative for Children, Women and Youth Development, that is ICWID. We work closely with Toto Africa and some other organizations that work with for children, women, and girls. So I'm here to be your moderator. My work is so easy. It's just to let you guys speak out, especially on the topic that we are going to discuss, and I'll be happy to listen. So, as I do the introduction for our panelists, I will start with our first panelist, who is Dr. Mehak Sigan. I hope he's joined us. Dr. Mehak is a professor, and he works with the Laboratory of Disease Dynamics and Molecular Epidemiologist, and he's a reproductive health, maternal and perinatal health researcher, and a public health expert, working as an assistant professor at Amity Institute of Public Health. So, Dr. Mehak, you're very much welcome.
Thank you so much, Jimmy. Thank you. It's an honor to be here. Thank you so much.
You're welcome. And my second panelist is Nancy Njeru. Nancy Njeru is a program officer. Nancy works with the COVAL, that is Coalition of Violence Against Women. Nancy is a program officer for TUPO, that is Tusikizwe, which is a Swahili word, means we are here, listen to us. A project of the Coalition on Violence Against Women, COVAW Kenya. And COVAW is a national women rights organization that exists to champion the rights of women and girls to be free from all forms of violence and envisions a society where women, girls enjoy equal rights, freedoms, and thrive in safe spaces. Short, Jeru, Nancy, hope you're here with us. How are you?
Hi, everyone. This is Nancy, and thank you so much for this opportunity, and I'm looking forward to the conversations. Thank you.
Thank you. Again, we have Smita Magar with us. Smita is a journalist, and he works with the Humwalang Gang Village Foundation, Nepal. He's a journalist and a writer interested in rural reporting, where she's focused especially on gender, education, health, migration, and human rights in post-conflict societies. She's a Chivering Fellow and holds a master's degree in conflict prevention and peace building from Durham University, England. She is a founder member of Humwalang Village Foundation, Nepal. Good morning, Smita. How are you?
Smita will join a little later. She's having some network issue.
Okay, that's good. Another panelist that we have is Tahira. Tahira is a humanitarian and a development worker and serving the sector from last 15 years. Academically, she's an anthropologist, particularly with a focus on gender and protection. She has a diverse experience of working on forced marriages, domestic violence, legal, popular cultural practices, women and child sexual abuses, workplaces harassment, child labor, water and sanitation, hygiene, food security, women entrepreneurship, skills development. She has experience of working under hard circumstances during different natural and man-made disasters such as earthquake, floods, IDP refugees. Through her multi-dimensions approach, she has been contributing towards poverty eradication on by all means and serving poorest and vulnerable communities. Good morning, Tahira. How are you?
Hi everyone, and thank you, Jimmy, for my introduction. I would be looking for the nice discussions further. Thank you so much.
You're welcome. The next panel that we have is Dr. Arushi. I think I've pronounced it well, Doctor. Dr. Arushi.
Yes, Jimmy, yes.
Now I have a good pronunciation today, yes. Dr. Harushi is a public health advocate and she works with Serona Hygiene Foundation. Dr. Harushi Bihar is a public advocate with a master's degree in public health involved in health education, healthcare, project management, research, health and environment protection, awareness through social media. She has over 5 years of rich work experience in various organizations. She has led and conducted breast and oral cancer awareness and screening programs in rural and urban areas. She's been involved in the advocacy and research on public health issues like basic and menstrual hygiene, sexual and reproductive health of women, and transgender. She has initiated, led, and been actively involved in community mobilization program in many villages. Good morning, Dr. Arushi.
Good morning. Thank you for introducing. Thank you for having me here.
Thank you so much, ladies, my panelists, and those who are joining us online for this summit. We are very much thankful for you, and I'm going to start asking Njeru. We have some questions that we would like you to address to us. So, Nancy, I would like to ask you this now. Unpacking patriarchal stigma of periods and socialization of communities on menstrual health. how what can you tell us about that?
Uh, Thank you so much for that question. To begin with, yes, you gave a brief overview of what COPA is doing, and on issues around menstrual health and culture and patriarchy, quite a lot has been happening, and most of the time you hear me giving reference to the Kenyan context, since that is where I'm working in, and which is closely related to the African context. So generally, when you look at our society, how normally they perceive the issues around menstruation, you find that there is a lot of silence on issues that are touching on menstruation, and that leads to a lot of myths and misconceptions, because when people do not want to speak out about this, the biological processes which happen to us women and girls, it's not our fault. Yeah, it's part of our life, but you find that there's a lot of silence that surrounds the issues of menstrual health, and most of this is perpetuated by the fact that in our cultures we have a lot of myths and taboos that revolve around menstrual health. For instance, I'll give an example of how the most of the African communities perceive menstruation. Most of them see it as a taboo. When a woman is menstruating, it's assumed that she's unhealthy or she's dirty, and that is all closely linked to a lot of period shame. Yeah, you find that a lot of girls, when it comes to that time of the month when they are menstruating, most of them miss classes because there's a lot of in case a girl messes the dress, or rather she begins her period and maybe she doesn't have the dignity kit, the dress or the clothes she's wearing, they get dirty. So even in the classroom, there is a lot of ridicule, yeah, and you'll find that at that point is when most of the girls, they miss out education, they do not go to school, and for that a week or two, they end up staying at home. And this is a clear indication that it continues to bring a lot of, to perpetuate the gender inequalities. Because if a girl will miss 2 weeks going to school because she's on menstruation, the boy continues being at school. So, and you find that it's difficult for the girl to cover up, or to cover the 2 weeks that she's missed. So even in the education outcomes, it becomes a challenge, because even it also affects the performance of the girls. Because if in a month a girl is missing 2 weeks, it means that in the year she'll end up missing these 24 weeks. That's close to a month. And whereas the boy continues with the education. So as a society, it's the high time that we start having open and candid conversations around menstrual hygiene, how to support our girls so that they ensure there's dignity when they're menstruating. It's not treated like it's a taboo or a sort of like something that is a negative thing that is happening in the community. Yeah. Maybe as we continue, I'll be adding more.
Yes, thank you. Okay, thank you so much, Jeru. I'm really grateful for that. Now, Tahira, Nancy has just talked about taboos, myths, and some cultural norms about MHM. Now, in Pakistan, please share with all of us what are the hardships that women in Pakistan face during the periods and the current situation in Pakistan vis-a-vis menstruation. How do you think you can create awareness on MHM in Pakistan? Tahira,
Okay.
please.
Thank you so much for giving me this opportunity. First of all, I would like to tell something about the cultural and the religious some issues like which are prevailing in Pakistan. It is a patriarchal society, and MHM is just like an issue which we are from our childhood, which we are asked. We are not allowed to discuss it in front of the elders, in front of the boys, men. So we are asked from our childhood that you need to avoid discussing this issue publicly and in front of the others. So one main issue is patriarchal culture and the brought up since childhood, which we are getting from our parents' side and from our elders. And the second thing in Pakistan is actually many humanitarian organizations and development organizations are working in this sector, which is related to the health hygiene and education even. But unfortunately, we are very far behind to project this issue within our institutions, schools, and public health sector organizations like hospitals and basic health units. So second thing is that, and the third thing which I would like to share here is the issues, access to the items and necessary accessories which are required during the menstrual cycle. So because of the lower socioeconomic backgrounds and financial constraints, people are not able to buy these items for their daughters, for their girls, for their wives. So this is very big issue right at the moment. So there, I would discuss these three things. First is the patriarchy. So we cannot discuss this thing publicly. Of course, I don't want it to discuss publicly and in front of the others, but the knowledge is important. Awareness is important. I would like to share my own experience in my childhood. I was not informed by my mother about this thing, and I my cycle started in my when I was in my ninth grade, and I was in the school at that time in the morning time, and I started this thing. And at the time there was no instructions to the teachers as well, that they could talk about this issue, and they will they can give me something to protect myself. So that day, I still remember that day and my feeling and my psychologically, which I faced on that day. And then when I get back to home, my mother was standing outside the gate and she was waiting for me, and she was saying that, "Oh my God, I have seen something on your trouser early in the morning, and I was really, really sad, and I was about to come to your school." So that was the psychological effect that is with me. I am keeping this effect till now in my life. I have three childs. I have two daughters. So one learning which I have from my childhood, that I educated my daughters first for this, because of course they have to face this thing in their upcoming days. So this is something. So awareness, knowledge, sensitization is one of the most important issue which we lack in Pakistan, in our culture, in our society. Second thing is the institutional setups in our schools. I haven't seen this thing in public sector schools, because I have two type. We have two type of schools in Pakistan. One is public sector schools, and the other one is private schools, which are run by the individuals and the other educational institutions. So in public sector schools, there is very less education kind of things which is given by the teachers to their students during that time. And there are no facilities, like no girl friendly washrooms, no inclusive kind of facilities which are given to the washrooms for the girls toilets. So one thing is, and second thing is, in public sector schools, they don't have any kits, MHM kits, which they are keeping with them. So suddenly, if a girl have something like this, so they can provide them, and they can facilitate the girl. But there is no facility like this. In private schools, they have initiated this from the last 5 years. I can say this is something which is going on inside the private sector schools, and they are keeping the MHM kits with them, and they are providing those children, because in private sector schools, the children who are coming, they are from well-off families, so they can pay on spot for their things, and they are facilitating them. But this should be free of cost, which is not available in any kind of schools, public or private. Second thing, this third thing is, which I want to share here, is the financial constraints which our most of the rural parts, the females are using very sadly, they are using different kind of things which I cannot even discuss, like a piece of cloth, and they don't know how to make it hygienic, how to wash these things, and how to recycle even these things. So these are putting some very bad effects on, even on the if you see the climate or environment, they are putting very bad effects on these things, and they do not know how to dispose of all these items. So they don't have access to the pads, to the panties and some other sanitary items which are now we are using in a modernized way, like tampons and menstrual cups. So they don't have any access to all these things. So third thing is, in urban parts, I can see people can manage, and they can buy something like this, and they can protect themselves hygienically, and they can keep themselves from these diseases which can happen due to the unhygienic management of menses. So these are some things. And the third thing is, currently, from the last 10 to 5 years, I can say, in Pakistan, I can say most of the humanitarian organizations have taken the initiative on this issue, just as like my organization, which is Muslim Hands. We are a charity organization, and our headquarters is in UK. But we are working in 26 countries around the world. So in Pakistan, Muslim Head has initiated this component under its a big thematic area, which is a water, sanitation, and hygiene. So we have incorporated the MHM component inside the wash, so that to avoid the resistance from the community side, because in our communities they do not like that any NGO or INGO or organization work on this issue. They think that it will spoil their girls, it will spoil their culture, traditions. So we have integrated this component with the wash component, so that people do not give the objections over this issue, or working on the INGO or organization. So we are doing this, and we are and the last thing, sorry, I'm taking much time. And the last thing, we have initiated this MHM component within the institutions, which are public sector schools, and basic health units, which are run by the government. And we are providing them and rehabilitating them, rehabilitating and constructing new washrooms and toilets inside the schools, which are girl friendly, which are PWDs, like for can be used by the people with disabilities. And we are providing them MHM kits as well, which they can use for the next 6 months. And similarly, in the public hospitals, and along with, we are making the clubs inside the schools, which are called wash clubs, and just consisted on the girls and teachers. And we are giving them trainings, and then further they are extending these trainings to the other girls and students and other people. And similarly, in public hospitals, what we are doing, we are training the lady health visitors, lady health workers, doctors, nurses, about this issue, and we are providing them MHM kit. And we are requesting them and giving them sessions over how to sensitize those females who are coming from the rural backgrounds and lower socioeconomic backgrounds, and how they can overcome this problem whenever they are getting this thing, and how they can avoid the hygienic issues during that cycle. Thank you so much.
Thank you so much, Tahira. That was very, very well elaborated, and
Thank you.
it's good, because at least now we know the way you guys are doing it on the other side of the world, which is so good, and it is nice. I like the approach. Approach is actually the wholesome approach, whereby you include both the public and the private sector, the hospital, everywhere. It's a good one. So that's a good approach. So now, Dr. Arushi, Nancy mentioned something about the dignity kit, and you know that in some other areas, some dignity kits are provided, but not everything is provided. Like you can find a place whereby parts are provided, but there are no panties. So maybe to ask you a question on role of sustainable menstruation for now and the future menstrual cups to end periods poverty. What do you say about that?
Yes, so I think Nancy very nicely mentioned about dignity kits and how there has to be some inclusive solution that we have to get to. And when we talk about sustainability, when we talk about sustainable menstruation, I think it's not just about how sustainable a product can be for the environment, but how sustainable or how usable, for how long can one product be used by the menstruator herself or himself, because we are now including menstruators as a term. So how that one product can actually last the menstruator, not just one cycle, but for many cycles, couple of cycles. So we need to think of sustainability from that point of view, from a point of view that the menstruator does not have to spend too much money on, on their menstruation every month, to how much better a product can be for their health. For example, the health hazards that started to have emerged among menstruators due to prolonged usage of sanitary pads, because we are not sure of all sanitary pads being of one standard quality. So I think menstrual cups, which have been introduced in many parts of the country, in many parts of the world in a big way, are an exact answer to many of these issues, where a menstrual cup is reusable for up to 5, and if maintained properly, for up to 8 years. A menstruator does not require panties to be able to use it. Unlike an absorbent product, it is something that collects menstrual fluid. So even if someone do not has access to panties, they can still easily go ahead and use a product because it is inserted inside the vagina. Speaking of how medically, safe it is made up of silicone, which is an inert material, does not react with the body. And since it is not an absorbent product, it is a product that collects menstrual fluid, it becomes all the more easier for menstruators to manage it. Unlike, many other options that they have been using all this while. For example, a cloth pad, which is a great option when we talk of sustainability and we talk of sustainable menstruation. But like Tahira ma'am also, mentioned that there's lack of knowledge of how to take care of these products. Also, in my view and the experience that I've had, there's lack of access of water itself. So we can't expect them to keep washing those pads, over and over again to a level where they can actually be disinfected. So they end up doing more harm than good, if I have to put it that way. And again, with a menstrual cup, literally 1 teaspoon of water is required to clean it, to wash it, which is quite a manageable amount for places where there's no access to water, or there's just one single point of water that supplies water to the entire community or the entire, village. So I think that is one of the greatest option and choices available to make periods sustainable. And sustainable, when I say sustainable, I think from 3 points of view. One, of course, the environment. Second, from the point of view of the health of the menstruator. And third, from the point of view of cost. And many organizations that are also working on ground, they know how difficult it is to go back to the same community and keep giving on pads, month after month. And in the time where all of us are facing a critical time of a pandemic, we do not know what is going to happen tomorrow, what strain is going to come in tomorrow. So the uncertainty is too much to risk the life of the menstruators, where they will end up feeling lost 1 month and they do not know what will happen the other. So I think a menstrual cup is a great option that now we have, and everyone, all of us who are working on ground shall try and explore that with the communities that we are going into. So yeah.
Thank you so much. That's very, very good. And I like the fact that people are coming up with new innovations. And like long time ago, where we used to, some of our sisters used just to wrap something like a towel, or if not a towel, just something like a piece of cloth to get to help themselves. Then later on, it became pads, and right now we are talking of cups. Good innovations, and we appreciate you guys for that. Thank you so much. Now, Dr. Mehak, how are you?
I'm good, Jimmy. How are you all doing?
I'm good. So
Very
this
well,
this
thank
this
you.
question goes to you. So what are the viewpoints of general men towards menstruation and towards a girl who is having her period? And the second question will be, because I would like you to combine the two. And the second question would be, according to research, a lot of trans men, non-binary and gender queer people have periods like any other women, but
Yeah.
they aren't aware about it and face a lot of issues like dysphoria. So how to address these issues? How can we deal with this kind of issues? This is something so unique to us, even to some other panelists, I think. Yeah. Yeah.
Yeah, so Jimmy, we've been talking about periods a lot, and periods are something that women and girls have been having for thousands and thousands of years. Okay, it's basically the reason that you and I are even here today. But yet, all around the world, there is still such an element of shame associated with the woman's monthly cycle. And I personally believe, because I'm an educator also, I mean, I'm in the academics field, I feel that the genesis of this is education, lack of education. Because if we treat menstruation as a normal biological phenomena, and we do not warrant any special measures for it, and this education should start from the school level, because that is where the boys, because you asked me about the general men and the boys viewpoint, because I feel that at the school level is where the boys start developing their own ideas. Now these ideas can either be based on facts or they can be based on myths. I have personally seen many boys and men being absolutely okay with periods, but yet I've also seen, grown men who absolutely have no idea as to how the reproductive system works, and whatever the knowledge, little knowledge they have, is from their probably biology class lectures, 1 or 2 periods that they had back in the school. So, education, open communication, and interaction, I think, are the three pillars where we can ensure that our men and our boys, they kind of understand what menstruation is, and it's nothing more than a primary biological function. So we, I mean, our heart beats. Our lungs ensure that we are breathing properly. So our reproductive system, I mean, the female reproductive system per se, is just ensuring that we are like sustaining life throughout this entire world. I mean, Tahira mentioned about patriarchy in Pakistan. So yes, we have those tenets here as well in India. So I mean, I'll be talking about from the Indian perspective. So
Yeah.
we, along with the patriarchal system that we also have here, we have a lot of religious belief component also in India. So, because I mean, we are a multi-religious country where we have people from almost every religion staying together here. So, that is another thing that becomes a little difficult to target the menstruation at a one point, because we have so many religions. Every religion has their own beliefs and their own myths associated when it comes to menstruation. Like for example, even today in 2021, we still have girls and women being sent to abandonment huts when they start menstruating. So imagine a young girl who's just started having her periods. She's 13 years, 14 years probably, and she's been sent to a secluded place for 5 days. I mean, and that is how the boys and the men who are growing up in their family will just see that, okay, so my sister or my daughter or my wife or my any other women in in my family are going to go to a separate place when they're menstruating. Why? Because probably it's dirty, probably it's associated with a lot of taboos. Right. So, I mean, the baseline is that we need to have an education system. We have to ingrain it into our own system. Like, we do not want. So, as a parent myself, I mean, I first have to be comfortable that in my child's school, some years down the line, they're going to be talking about what is menstruation. They're going to be talking about safe sexual practices. They're going to be talking about STDs. Now, when we start ignoring all of these words and we start saying no, 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 we start putting them under the blanket and saying that we don't want to talk about that. That is the ideology behind that. Our kids will start growing up in the same ideology. They'll start thinking that it's bad to talk about menstruation. Our girls will grow up thinking So we see girls whispering to each other if they start their periods in a school, that do you have a pad, or do you have something that I can use? They'll write notes to it, or they'll like whisper. Why? Because it's a very general phenomena. So if we are able to change the narrative, only then we'll be able to change the attitude towards it. Because you first need knowledge. That knowledge translates into positive attitude. That positive attitude will translate into a good evidence based practice. That's exactly how, anything will work. That you need to have a knowledge for that, you need to have the positive attitude for that, and then you need to translate it into your practice. So this was about, like, about how, what are the viewpoints for men. And I think you asked me another question about trans men and non-binary. So today we are no longer trying to put people in two categories, male or female. No longer that works. We are not like a black or a white world anymore, because we have recognized that we can have a gender spectrum. Like, you can have a spectrum of gender, and then a person can choose to be anywhere on that spectrum. Now, many people can identify, whose gender identity falls under your transgender or non-binary umbrellas. So they experience gender dysphoria. Now they already are battling with understanding what their gender is. Is it same as that of that they were biologically born with, or is it something else? So they're already facing that kind of an issue. And then along with that, you have the sense of unease that the person may have, because there is a mismatch. So for this also, we just have to simply understand that it's not only the women, but you can have anybody who's a menstruator. That's why Arushi was also talking about that. We no longer say that it's only the women who are menstruating. It's, we say a very general word these days. We talk about menstruators, because menstruator is not only a woman thing. It can be an experience that is highly variable. You can have it in a different way, I can have it in a different way, and it can mean different things to different people. So it's not necessary to genderize body parts or bodily functions. So we need to demystify and probably destigmatize menstruation without shutting anyone out. So if we can go to a so generally what happens is, we are associating colors with all our period products. So you will have like a pink cup, or you will have like a the packaging of your cloth pads, or of your the absorbent pads that we have. They'll be associated with one particular color. So if with that color, if a person who's a trans man, or who does not associate himself with that pink color, will feel not comfortable using it, because from the beginning we've done this, that pink color is associated with the woman. So these are just some of the things we'll have to change, and we'll have to accommodate and understand that menstruation is not just a woman's thing. It can be associated with any gender. Once we understand that, then our healthcare system can modify, then the society can modify. So it's actually a multi-step process. It does not happen immediately. But the first thing is that all of us who are here on the panel today, all of us are doing whatever we can for menstrual hygiene, and for ensuring that women and men who are menstruators, they are doing it with dignity. And Nancy spoke about dignity kits. So I like the concept that we're talking at dignity kits. We're not talking at something else. So that's something that the narrative has to change. And so one step leads to another. Currently, the lower middle income countries that we are talking about, LMIC, it can be Africa, it can be India, it can be Pakistan, it can be Bangladesh. Our healthcare system is not that holistic that we can take care of all of these gaps. So the onus lies to the organizations working for it, like the non-governmental organizations. And then slowly, I think our healthcare system will also expand, and will also be able to make it inclusive. So that's what somebody else can add to my viewpoints. So this was something that I wanted to talk about. Jimmy, I think you're on mute.
Sorry.
Yeah.
Well, thank you so much. Thank you so much. That was very, very informative. And we've gotten so much from you. And new things. We are learning new things here in this platform. We are actually learning. Personally, I'm learning very, 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 very new things. So Nancy, you've heard what how informative Mehak was. So my next question to you is that what hinders women and girls' ability to manage menstruation?
Okay, thank you, Jimmy. What the key hindrance to women and girls during menstruation is, the first thing is the silence that surrounds the menstruation, issues around menstruation. Because when this issue cannot be addressed publicly, it means that women and girls, when they are facing challenges, it could be health or even the access to these menstrual products, they're not able to get someone whom they can talk to and be able to find a solution to that. And I'll give an example. There's a speaker who mentioned about issues around poverty. Because at this point, when you look at the current COVID-19 pandemic situation, you find that there has been an economic downturn, the households have lost income, and this brings in the challenge of access to this the menstrual products. In Kenya, a packet of the always pads goes at Kenya shillings, 50 shillings, that is half a dollar. And you find that we have several households, or most families, we find that most of them live in survive in less than a dollar per day. So if a packet of always sells at half a dollar, it means that this family they have or rather, the purchase of this menstrual product will not be a priority to them, because they have to prioritize the basic needs. These are like things like accessing food, water, or even paying the rent. So most of the time you see that even at the household level, how do we prioritize the needs of women and girls? This challenge comes right from the household. Access to these menstrual products is not a priority. Even those of us here in this panel, we need to ask ourselves, even when we are planning in our house, the shopping, yeah, how do we plan how we are going to spend these funds? Do we allocate funds or some resources to go towards supporting, if we have girls or even ourselves, to purchase this product? We classify it as a by the way, yeah. We'll buy when we get there, but we need to start these conversations right from the household, even to the policy level, yeah, in their homes. As we plan for our families, for our girls, for women, we need to ensure that it's something that is spoken in public, yeah. Even when you're going to shop, you should not feel embarrassed that you want to purchase a packet of the sanitary pads. You need to have that confidence. You don't have, because I've seen what normally happens in Kenya. When I go to buy the pads in the local shop, you find the shopkeeper struggling to wrap that pad so that it's covered in a newspaper. What does that tell us? There's a lot of, we are not comfortable even carrying these things, the sanitary pads around, yeah. We need to have confidence such that we get to a point that when you're going to purchase, you're not embarrassed, because it's a normal biological process, yeah. It's not your fault that you're menstruating, because that's how we are created by God. The other issue is about, another barrier is, I'm looking at the policy level. Are our policies responsive to the needs of women, girls, including the women with disabilities? How are we supporting them to access this product? Are they affordable? Are they accessible? Yeah, because in all the countries that we are representing here, I'm almost certain that that is one of the gaps. Are our policies responsive to these needs? Yeah, are these products accessible to our girls in school? How are we supporting them to ensure that we retain them in school, they are enrolled in school at the right time, and when it comes for them to get into that menstruation period, they're able to be retained. We do not have to have girls go home for 2 weeks. They finish up that period of menstruation, then they go back, and they'll find that the boys have really progressed. So those are some of the key barriers that I can point out to. One is the issues around the economic issues, and also the social aspect, that there's a lot of silence that surrounds the issues around menstruation. Thank you.
Thank you so much. Now that you have talked about the socio-economic part of it, I would like to ask you another question before I move into to ask another panelist question. But before that, I would like to welcome those who are joining us online, and I can see a few people have joined us, and we have like Auko Adega. Hi, how are you? You are very much welcome. Thank you so much for joining us. And the rest who are cannot see them, of course, they cannot see their faces, but they are with us. And the number is really growing, and we appreciate and thank you guys for that. So Nancy, just on before I release you and I go to somebody else, I would like you to maybe help us on the role of the state and non-state actors play to promote menstrual health.
Okay, I'll start with the first with the non-state actors. I'm looking at even the private sector. We had a mention of the menstrual cups, because in Kenya the uptake of that product is very low. Even in the community, there was a time we tried to bring up that conversation, and you could tell there's a lot of myths and misconceptions around the use of menstrual cups. Some were saying that if I use this at the cup, I'll end up getting barren. My husband will not be comfortable. You see, so it's about how are we engaging. There's that partnership between the community and the public sector. Like, the people are producing this product. As we produce them, are we engaging the community to empower them with information to understand why should we encourage the use of this product? And the other thing is about the accessibility and affordability, because personally in Kenya, especially in the Kwale community where the project is based, I haven't seen those cups being used. And one of the barriers is about the myths and misconceptions around this product. So the first thing we need to look at the private sector. These products, as we make them, are we involving the community by sensitizing them, or we are just making them and bringing them to the market? Because if we don't sensitize them, the people to know why are we preferring the use of these things compared to the others, it becomes a challenge, because the uptake will be a challenge. The other issue is around, there was also the use of the reusable, the parts, is it the ones that you can wash, yeah? Because that's one of the things that the community preferred, that if they were supported to learn how to make them, it becomes easy for them to even support their use. So we should also ensure that even as we're making this product, we need to empower the community with even skills, so that when we empower them with skills economically, we are trying to uplift them. Because when a woman in the village is able to make this product, it means that she can sell at just a small price to the community, and that will be one of the ways to empower her economically. Going back to the state actors, I'm looking at mostly our policies. How are they? In the budgets that we are making at the national or even the subnational levels, are they addressing really the needs of women? Yeah. If it's the access to this product, are they accessible to the women? Or we are saying that the pads are zero rated, but still we have to pay for this product. So what I'm keen on is, or rather in the advocacy, because mostly we are doing policy advocacy, is to ensure that, one, because in terms of policy, it's one of the barriers, we need to ensure that these policies that we are making, they are responsive, or they are speaking to the needs of our women, girls, including the persons with disability. If we are talking about, if we want to enhance the education and health outcomes of our women and girls in the community, we need to look at what are some of the barriers that they face, so that we ensure that they are at the level playing ground with men. Yeah. If a barrier to education is about our girls being unable to attend school during that period, are we able to support our girls to access this product? Yeah. Secondly, even in the schools, what are some of the we look in Kenya, we've had a challenge in terms of the curriculum. Yeah. Access to this information, the sexuality information, sexual reproductive health information, it's not accessible to these to our youth, women, girls. And what happens when this information is not accessible? These groups of people, they have to find alternative ways to get this information. And what happens is, if it's a girl in the village and she starts menstruating, in the school, she's not accessing this information. At home, the parent does not even know where to start in giving this information. I'm going back to the issues around silence. Yeah. So we need to ensure that we are investing in ensuring that these people are able to access timely, reliable information on their sexual reproductive health, so they're able to make informed decisions about their sexuality. Thank you.
Thank you so much, Nancy. Thank you so much. And I can see some other people also so joining us here and texting and telling us about the positive parenting. Ruby, thank you so much. Ruby, right? Thank you so much for that, for your information, what you've written and you've seen. And the issue we are discussing right now here, it's something that is something that it used to be a taboo to us as Africans, let's say as Africans, and I don't know about the other people out there, but I believe it's a biological thing. And I have a 15-year-old girl, and the first time that she went through the first day, now because I have a very good relationship with her and we talk a lot and we discuss, and most of the time we joke a lot. So the first time she went through this, she never came to me and told me about it. She went to the mother, and the mother told me. So what I did, I just took her plus the mother, and we went straight to the supermarket. And I told her, I went directly to where the parts are, and I told her, now pick. I want you to pick how many you want, which you can. Then she looked at me and she was surprised. That, how did you know? I told her I know about it because your mom told me about it. So I wanted you to feel comfortable sharing all this with me so that you don't feel like you're left out. I'm part of you and I'm part of this, and I'm here to assist you in one way or the other. So she was very much happy that I know what is happening in her life, and I'm there to support her in all this. So these things to some other people, some other parents, we have different cultures. Even where we live right now, we have different cultures, and not everybody, not everybody can be in a position like I am, like I was. My child first experienced that kind of menstruation. So Tahira, you talked over awareness. So my next questions to you would be now, what do you think the next steps forward in relation to your country, Pakistan? What is the next step? You've talked of awareness; it was well elaborated. So, what is the next step for you for your country, Pakistan?
Yeah. Thank you so much. Actually, lack of knowledge and the lack of education regarding this issue is very much required in Pakistan right at the moment. And most of the organizations, which are non-government organizations, are working on this issue. But I think one of the strongest recommendation is the public-private partnership, which is the most important thing currently. It is for sake of sustainability as well, because when the government and the non-government organizations will work together, it will make the thing more strong, and it will make the things and it will give the ownership to the communities. So I think this is one of the most important thing. Government and the non-governmental organizations should work together right at the moment, including the international donors who are interested to work on the integrated approach of water, sanitation, hygiene, and they can incorporate the MHM component inside it. And of course, we cannot leave the issue behind, the climate change. So all things will work together as an integrated approach, and we can work combinedly with a holistic approach, involving the local communities and giving them the ownership to come forward. So this is something which I am looking forward, and I want to recommend about it. And the second thing is, social media is a very good source of communication, and now you can see even in rural parts, even normally the girls and the females who are not going to schools, they are out of school, and who are at homes, housewives, domestic workers, they have phones with them, and most of them have smartphones with them. So this is something which we can create through utilizing the social media, but we need to select the language according to the cultural and religious restrictions, because if we talk directly about this issue, then might be there can be resistant groups who can come forward, and they can talk with the government, and they can make hurdles to do that agenda, and for the sensitization. And third thing which I think which can work, it is inclusion of MHM as a subject inside the curriculum of schools. So we can add this thing in the curriculum, but not from the very lower classes. Like you can say, we can start it from the class 4 and onward, so that the girls and the boys even, of course, because the national curriculum is the same in each country, so we can say it should be part of the curriculum, so that they can get the awareness and education about this thing. Second thing, the curriculum must be more focused on the management of this thing, not the telling the story, what is this and what is this. Management of this thing is important at the moment, so we can promote this thing through these three ways, like public private partnership, second social media, and third is the inclusion in the national curriculum. Thank you so much. Your mic is off.
Thank you so much. Sorry, thank you, thank you so much for that. And now we know the way forward in Pakistan. Now let me come back to you, Dr. Mehak. Uh, uh, I know that you have talked about the research and everything about the transgender, the men, and everything about that. So my questions, I'm going to ask you two questions, which I think you'll be able to combine and answer them because of time. The time is really moving so fast. So my question would be to you, Dr. Mehak, is that some transgender and gender non-conforming people who menstruate feel alienated, as all the periods products are categorized as women's products, and they even avoid purchasing them altogether. So how to deal with this and normalize periods and buying periods products for these people? The other question would be, a lot of transgender women undergo hormonal therapy, and as a side effect, they experience symptoms similar to those of premenstrual syndrome (PMS) or premenstrual dysphoric disorder (PMDD). Provide tips on how to track them.
Thank you, Jimmy. These two questions, if time would have permitted, I could have spoken like, for an hour, because the questions that you've asked me, it's very difficult for me to concise the answer and just put it in like a minute or two, but I'm going to try. First, I think if I remember, the first question was that, the transgender and gender non-conforming people who menstruate feel alienated, I think, because of the period products are generally categorized, as we say, like the woman products. This was exactly that I was saying that, we have designated period products as feminine, and obviously that is so. As a marketing strategy also, if I talk about from a sales or a marketing perspective, if I want my product to appeal to the women, I would want it to look feminine. I would want it to be in colors which women like to use. I mean, that's not the marketing people's fault as such, but what has that resulted in? That has resulted in not making menstruation inclusive. That has resulted in ensuring that period products are only exclusively available for women. So that is where we need to change the narrative. We need to stop using gendered terms, and we need to use non-gendered terms to ensure that there is a unanimous availability of period products. Now, obviously, it might not come very naturally to us. It might seem very awkward right now to say, but we have to start saying statements like people who menstruate or people with cycles. So instead of just saying that it's a woman's issue, or so I mean we need to stop doing that. And this is just like changing any other biased language, because we have the language that we speak should be gender inclusive. So as a society we need to broaden the use of products, not classify them as either masculine or feminine, because there are so many non-binary females whose gender expression shifts towards masculine or androgynous during the week of their periods, and it offsets the entire femininity of bleeding. Now others also, like I was just saying, that some of us do not they don't choose menstrual products that don't come in pink or hyper feminine packaging. So that has to, like, change if we want to make menstruation inclusive. Now I'm not saying that stop making products that appeal to the female population or the women, but at least ensure that you're making products in different variety. That variety has to be there, because whenever, as a public health professional, that when we go down to the community and we try to give them contraception measures, so we never say that you take this, we give them a basket of choices. That's exactly what we've been doing. We give them basket of choices. So I feel for the period products also, there should be basket of choices available, so that male, female, gender non-conforming, transgender, cisgender, anybody who wants to pick their own period product should have one product to pick from. It's like saying that if the female washroom is not available, the females can go to the male washroom. So the entire focus when you're entering a male washroom might not be like, it's not for me, this is not meant for me. So you will not feel that sense of belongingness. And that's what this entire summit is all about, that we need to normalize periods. Anybody who's having periods needs to understand that it's completely normal. So how do I make it normal? I make it normal when I start picking up my own products. I start making them sustainable, because yes, sustainable menstruation, like Arushi and all of you have been focusing on, is extremely important. So let's ensure, can we like put a basket of choices for sustainable menstruation, which will appeal to the all this gender spectrum that I was talking about. So I mean, that is one thing that I feel that we can normalize periods, and we can, that will help us in buying period products for transgender people or gender non-conforming people, because they menstruate, but they're very alienated. They're very alienated, as because when they're going to the market or a superstore, or any online also, you just see everything, every product is available which is more appealing to the feminine side of the population. Now if somebody is not that feminine, so what do you do with that? You don't need to buy that product. So you need to have products which are inclusive, which will appeal to all the gender spectrum people. And then obviously when we're talking about transgender, we're talking about cisgender, so they do undergo hormone therapy. And because of, as a side effect, they start experiencing symptoms which are similar to premenstrual syndrome that you were asking me. So I mean, some cisgender women, which are like assigned females at birth, they don't have periods due to menopause, stress, disease, hysterectomy, or they may never have started menstruating only because of variety of medical conditions. Right. So at the same time, there are people who menstruate, but they aren't cisgender women. So I mean, because of this, terminologies that we've coined. So I like to say them as gender spectrum, because you have trans men, you have intersex, you have gender queer, you have non-binary. So when you talk about gender, so you have a lot of terms these days, and you can associate yourself with any of these terms. So I like to call it like a gender spectrum, that you can be anywhere on the spectrum. So the bottom line is not to relate menstruation issues to only women. So if a woman, if anybody who's menstruating will have issues associated with it, like you can have cramps. Now this becomes even more these days important, because medically speaking, you have PCODs, you have endometriosis, you have cysts, you have so many allied medical conditions which can aggravate the menstruation issues in women. So once we have made inclusive products, once we have said that menstruation is not only a woman issue, then we can start talking about the PMS or the premenstrual dysphoric disorder that you were asking me, right? So then we can start demystifying and destigmatizing menstruation without shutting anyone out, and we can say that let's all come together and let's all talk about because as a female also, like I mean, I'm sure all of you will agree that each one of us has our own experience of menstruations, right? So I might have a very easy one, or someone might have a very difficult one. So the same goes for the trans men and the transgender people also. So we just need to be inclusive in our terminologies. That inclusion has to come in. The products available has to be sustainable, yet it has to be inclusive for everybody. We have to ensure that we are like making it appeal to them, making them not feel as if these products do not belong with them. So, and obviously, yes, and if somebody is experiencing severe medical issues relating to menstruation, then yes, meeting the doctor might be an excellent idea, because sometimes it's a little difficult to handle our menstruation issues ourselves. We need medical help. We can have like an underlying issue, a pathological condition as well, which is aggravating our issues. So we need to like get that also checked. So I mean, yeah, I hope I
Oh,
was
thank
able
you.
to answer, because whenever we talk about gender, there are like just so many terms, and I can like just go on and on about everybody. If time would have permitted, I would have like taken it up, broken it up into like talking first about transgender, then talking about cisgender. But I'm sure like we don't have that time. But yeah, I hope I did justice to your question.
Thank you so much, Nehat. Actually, you did justice. It's only that the time is not on our side, but maybe probably next time. I think we'll have enough time. I pray that this time around, when we will be having this kind of a summit, we'll do it physical, so that at least we'll have just enough time to explain and elaborate more. And of course, there's some new terms that have come out that some of us didn't even know, and the way and the need also to be broken to us, so that at least we understand it deeply. So, of course, our time is up. I would just like to give each and every one of you just like 2 3 seconds just to say a word of bye bye, and because the other panel is the other panel is coming in, so I'll give each and every one of you time to say something before we leave this platform. So I will start with you, Arusha. What is your take on this, and what can you add in this in 2 seconds?
I think first of all, a big thank you to all the panelists and Jimmy to you for bringing about such amazing conversation around periods and around breaking the silence and around how we need to be right up there and talk about it. Because this has to stop, and somewhere this new beginning has to begin, and which all of us together need to work on. So I think the way forward from here is, like Nancy said, that we need to handhold people who are on ground, who are in the communities, and the producers who are producing new products to make periods easier. These products need to reach the people that actually require them the most. So I think the first and the foremost step is to go out, educate, handhold, and introduce products that could make periods easier for people where the silence prevails the most, which is in the communities. And in the areas where the entire taboo, the entire silence is the most. So I think from me, the next step from here on would be to collaborate more, to reach out to people in the communities more, to handhold them more.
Thank you so much. Thank you so much. Collaborating more and talking about this, and of course, Tahira gave us her way forward. Just a word of bye bye from you, Tahira. And,
Yeah, thank you so much, everyone. And I'm so happy to join this conversation, and would be looking forward for next upcoming conversations. And we will have inshallah, a very good discussions in future months and coming days. So thank you so much, everyone. And I have a good learning from Dr. Arushi, Dr. Mehek, and Jiru, and Ruby, and of course from you, Jimmy. Thank you so much.
thank you so much. And let me give this opportunity to a lady from my country, Nancy. Yes, Nancy.
Yeah,
Your last word. Yes.
yeah. Just to wrap up what I was saying is the two key points I would like to put across is a way to address issues around menstruation stigma Number one is we need to normalize the menstruation conversation as a way of destroying these taboos that exist. Secondly, we need to work with men and boys as allies in order to promote menstrual health and have healthy conversations about menstruation, because this will be key to promote healthy habits and break the stigmas around the natural process among women and girls. Thank you.
Thank you so much. Thank you so much. Thank you so much. I hope as a moderator, I have done justice to everyone. So I will give Mehak just to give us just the last word as I wrap up. Mehak, please.
Jimmy, you have done an amazing job, and I'm really grateful to all the panelists for doing such wonderful jobs wherever you are. And my last word is just please keep doing that. All the boys and all the young girls that are growing up now, they are going to be so thankful to each one of you, because you guys are doing an amazing job wherever you are, be it Pakistan, be it Nepal, be it Kenya, Africa, wherever you guys are. Just keep doing. Great job, all of you.
Thank you so much. Thank you so much, ladies. And now just one gentleman has joined us, Agawal, as we finish. So thank you guys so much. Thank you for those who are with us, those who joined, like Auko Adega, those Ruby. There's another one. She just disappeared. So many people who was with us in this first panel, and I'm grateful. Thank you so much for your time. And thank you. I can see some gentlemen now. The pictures are, the videos are popping out. And thank you guys for being with us. Thank you guys for being with us, and we really appreciate your contribution. Even listening was so good, and appreciate so much.